much need, my dear listener. For any inquiries, kindly call 073 00 11 888, 07 300 11 888. Call that number today for all the inquiries, my dear listener, and the guidance that you need. But most importantly, my dear listener, have you ever wondered why so many women struggle with heavy bleeding, painful periods, or unexplained pelvic pain, and yet rarely talk about it? Could uterine fibroids be the silent cause behind this suffering? Today, we talk about our health, my dear listener, and we are unpacking these common but often misunderstood conditions courtesy the Aga Khan University Hospital, a center of excellence in specialized and advanced medical care. So joining us in studio this morning is Dr. Nashad Karim, a consultant intervention radiologist at the Aga Khan University Hospital, to help us understand uterine fibroids and a modern, less invasive treatment option known as the uterine fibroid embolization. So if you have a question, kindly ask, and the doctor will be responding to you. 0712 22 3385 or on Facebook page Radio Mini 88.3 FM. Dr. Karim, a very good morning.
Good morning.
How are you?
Good, how are you?
I'm very fine. Happy to have you this morning.
Thank you, it's a pleasure to be here.
Yes, from the wards to the microphone. Welcome to my office.
Thank you.
Before I visit you in your office.
Yes, your office is more fun.
It's more fun. Anyway, Daktari, welcome to our conversation this morning about fibroids and every other thing that is involved. But first things first, kindly introduce yourself with what you do at the Aga Khan University Hospital.
Yeah, so I'm Dr. Naushad Karim. I'm an interventional radiologist. An interventional radiologist uses X-rays and ultrasound to carry out procedures. So unlike traditional procedures which involve making a large cut, here we use small incisions or very tiny incisions, and the imaging guidance, be it X-rays or be it ultrasound, to guide the treatment. So we're able to basically carry out minimally invasive procedures to treat different conditions.
Okay, and actually you are the right person to guide us through this conversation because of the kind of topic that we're talking about here. But first things, Daktari, what exactly are uterine fibroids?
So uterine fibroids are benign growths that occur in women. Up to 50% of Kenyan women suffer from fibroids, and they're benign growths, but they can cause symptoms such as heavy bleeding and painful periods. And when they cause symptoms, they need to be dealt with.
Okay, up to 50% women suffer this particular condition. So how does it occur in a woman's body?
So it's genetic. So there are certain risk factors such as not having children or having children later in life. Those are risk factors, but it is a genetic thing. So most, or we can say at least 50% of women end up developing fibroids.
Okay, so at least 50% end up because of the genetic nature of it. So how are some women more at risk than others?
Yeah, so the risk factors that can increase your likelihood of having fibroids. So, for example, starting to experience your periods at an early age, not having many children, or having children later in life, for example, in your late 30s or late 40s, means that you're at a higher risk of developing fibroids.
And now that we are talking about uterine fibroids, what should women know about this particular condition?
Well, so first, women should be aware of the symptoms. So heavy bleeding, painful periods, bulkiness in the pelvis are all due to fibroids. And a lot of women attribute the heavy bleeding to just being the part of their normal cycle, but if there is heavy bleeding, it's good to get checked to see if you do have fibroids or not. And if you do have fibroids, then there are treatment options available. A lot of women who get diagnosed with fibroids are afraid of surgery because that's the most common treatment option that's offered. But there are minimally invasive treatment options available, which make a real difference because there are no cuts, so no prolonged healing. And which deal with the symptoms very effectively.
Okay. And talking about many people being afraid, many women being afraid to go for treatment because of the surgery, some women live with these symptoms for years. If fibroids are left untreated, what happens?
Well, if they're left untreated, then the patient continues to suffer from the heavy bleeding. They get anemic. Means that they're losing out on the days of their periods, they are losing out, they have to stay at home instead of going to work. It affects their social life, they're not able to go out, they're always tired, fatigued because of the heavy blood loss. A lot of times also there's the accompanying symptom of painful periods. So again, painful periods, women are not able to do their daily activities when they're suffering from this. So there is a consequence of not treating, which is anemia and basically all the things that come with it.
All right. And talking about painful periods, Daktari, at what point then should that woman say, let me go and see the doctor?
So if there is, if a woman has heavy bleeding or painful periods, yes, she should see a doctor and at the very minimum get an ultrasound to see what's happening in the pelvis. Fibroids are a common cause of this, but there are other conditions that can also be causing this. So the first thing would be to see a doctor, get an ultrasound, and see what's going on.
All right. And talking about seeing a doctor, once fibroids are diagnosed, what treatment options exist today?
So generally we can say that there are 4 treatment options. For women who are near menopause, they can wait because the hormones that drive the growth of fibroids disappear at menopause and the symptoms disappear. There is medical therapy as well, which includes medication that improves your blood's coagulation, but that treats the symptoms, not the cause. The third treatment option is surgery. A lot of women are afraid of surgery because of the large scar, the prolonged healing, and the potential complications that can happen. The fourth option is minimally invasive treatment, like uterine fibroid embolization, which we offer at Aga Khan Hospital. This is a minimally invasive treatment, so it just involves a tiny incision in your left wrist, and then we go down with a tiny thin tube to the arteries supplying the fibroids and block them. So there are no large scars, so there's no prolonged recovery period. You go home the next day.
Okay. Yeah. So is it now a viable options to women today? Because as you put it, most women are avoiding treatment because of the normal surgeries that they need to undergo.
Yes, it is. Uterine fibroid embolization globally has been in practice from 1995.
Right.
And up to date, more than 1 million patients have undergone this procedure worldwide. In the US, 20,000 patients undergo this procedure every year. In Kenya, we've had this procedure offered at Aga Khan from 2009, and we've done more than 1,000 patients from 2009 to date.
Okay. Other than uterine fibroid embolization being less invasive, what other key advantages does it offer compared to the normal surgery?
So the recovery period is much, much shorter because there are no large cuts from which you need to recover. The potential for complications is also much less. Again, because there are no cuts, so we are not messing around with any of the other organs in in the abdomen or the pelvis. So the recovery period is shorter. It's fewer complications, and it basically means that you're back to your normal life much more quickly.
And for that patient who's listening to you and they're getting excited about UFE as an option, and they're about to make that decision to go for it at the Aga Khan University Hospital, what should they expect?
So initially, when they come in for a consultation, we evaluate their symptoms. We ask for an MRI to map out the fibroids and to see if there's anything else that's causing the symptoms. And once we see that the symptoms are suitable, their MRI findings are suitable, then the next step is to plan for the procedure.
Okay. And as I was doing my own research about uterine fibroid embolization, I discovered a concern for most women. And a big concern for many women is fertility. Can a woman conceive after undergoing uterine fibroid embolization?
Yes, so that has been a concern, but as more and more research is done, it is now proven that fertility rates after embolization are similar to fertility rates after surgery.
Okay.
So the two are equivalent in terms of fertility outcomes. What we advise is don't get pregnant in the first 1 year after embolization, to give the uterus time to recover and to give enough time for the fibroids to shrink so that they don't interfere with the pregnancy. In 1 year after UFE, you shouldn't get pregnant to give your body time to heal, right? Yeah.
And who is this procedure best suited for, Doctor, especially for women who still desire children then?
So best suited for women who are in their 20s, 30s or 40s, who have fibroids and who are, the fibroids are symptomatic, so they're causing heavy bleeding and pain. Those are the best candidates for this procedure.
Okay, yeah. Meaning that it is not suitable for some.
Well, there are some patients for whom it would not be suitable, if there were some other coexisting conditions which were also causing the symptoms, which could be dealt with surgically. Like endometriosis sometimes can happen together with the fibroids.
Okay.
So for some conditions, we would say that surgery is better, and that's why the MRI becomes important.
Yeah, and you've mentioned about endometriosis, and that is also coming up as a concern as well. That is actually some of the symptoms of fibroids and endometriosis are more like similar. How do these two different conditions actually might confuse women in terms of detecting the symptoms?
So endometriosis causes painful periods.
Yes.
And it may not have the heavy bleeding that fibroids would have. So fibroids would have more of heavy bleeding, but endometriosis would have more of the painful periods.
Okay.
Yes, the symptoms can be similar, and that's why besides the consultation, the MRI becomes important.
Yeah. Okay. Yeah. And for a listener who suspects they may have fibroids, Daktari, how can they access more information or consultation at the Aga Khan University Hospital? How do you take them through?
So we have a clinic, an interventional radiology clinic, Tuesday afternoons, 5th floor, Doctor's Plaza. So we can see them there and take them through the procedure and evaluate them further.
All right. Yes, my dear listener, that is it. As we continue this conversation, in case you have a question, 0712223385, we are talking about uterine fibroid embolization, my dear listener. The treatment that is used to help those women that are having this particular condition, uterine fibroid condition, my dear listener. Do you know somebody that is suffering suffering from this condition, tell them that their suffering has a solution, my dear listener. Let them not suffer in silence. That is why the Aga Khan University Hospital, through their specialist, my dear listener, are offering these uterine fibroid embolization, a treatment that will go a long way in terms of giving you good health, my dear listener. In case you have a question, you can reach out to the Aga Khan University Hospital, my dear listener, via the number 07300 11 888. 07300 11 888, my dear listener. That is the number. We are taking a very short break. I'm going to be back with Dr. Nashad Karim, a consultant interventional radiologist at the Aga Khan University Hospital.
88.3 FM. This is Radio Waumini, 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 88.3 FM. Radio Waumini 88.3 FM. This is Radio Waumini 88.3 FM. This is Radio Waumini 88.3 FM. This is Radio Waumini 88.3 FM.
At Aga Khan University Hospital, and we are talking about uterine fibroid embolization. 0712223385 or on Facebook page Radio Mini 88.3 FM. Good morning, Bram. Greetings to Daktari. Kindly let him repeat about what the medication that fits those who are suffering from uterine fibroids and how we can get those services at the Aga Khan University Hospital. This is Annette. Daktari, yes, just repeat for the benefit of those who are tuning in right about now, the kind of those people who suit this kind of medication that we're talking about here.
Right, so we can basically just go through again the treatment options for those who are tuning in. So basically you have 4 treatment options if you're suffering from fibroids. If you're near menopause, then you can wait till menopause, because the hormones that drive the growth of the fibroids disappear at menopause. The second treatment option is medical therapy, and basically this consists of medication that improves your blood's clotting ability and hence reduces the heaviness of your periods. The thing with medical therapy is that it treats the symptoms, not the cause, and of course there are side effects such as the risk of developing clots in your legs, etc. The third treatment option is surgical, but a lot of women are scared of surgery because they don't want to get a big scar and long recovery period and the potential complications. Then the fourth treatment option is uterine fibroid embolization, minimally invasive technique, which involves just a tiny 2 millimeter scar in your left wrist, and that's it. So a very minimally invasive way of treating fibroids. We carry out the procedure, and the procedure lasts around 45 minutes. And you spend the night in the hospital to recover, and you're home the next day.
Okay, it is as simple as that. And once I'm done with this particular procedure, Daktari, how long will I take for me to get back to my activities?
So after the procedure, you will experience some pain and discomfort in your pelvis as the fibroids die. So that lasts for 1 to 2 weeks. So we normally say that for 1 to 2 weeks, you should be on a sick off to allow those symptoms to be dealt with. So the good thing is that those symptoms are dealt with by medication. So so for 1 to 2 weeks after uterine fibroid embolization, there is some pain and some cramping, and you may experience some nausea and maybe fever, but that's it. And it's all controllable by medication.
So are those that you've just mentioned some of the side effects that a patient might experience after the procedure?
Yes, those are,
Okay. Now, talking about fibroids, Daktari, are there different types of fibroids, and does the type affect symptoms or treatment?
Yes, so there are different types of fibroids. So we can classify fibroids based on their location within the uterus. So they can be those which are just under the lining of the uterus. They can be those that are in the wall of the uterus. And they can be those that are growing outwards from the uterus. So those that tend to be under the lining of the uterus tend to be the ones that cause a lot of the heavy bleeding. Whereas those that are growing outward from the uterus tend to cause the symptoms related to the size of the fibroids. So that is like pressing on the intestines or pressing on the urinary bladder.
So based on the position, the symptoms will be different.
Yeah.
That is what I'm getting, right?
Yeah.
Okay, so my dear listener, it is better for you to understand that. Now, can fibroids now grow on their own or change size over time, just on their own?
Yes, so fibroids keep growing. So when you're diagnosed with fibroids, if you do not deal with them, they will keep growing and the symptoms keep getting worse. Yeah.
What about, does it also happen for those people who are experiencing menopause?
So at menopause, the hormones that are keeping the fibroids, basically driving their growth and keeping them alive, go away. So the fibroids then start dying and shrinking.
Okay. Now, what will happen, Daktari, if these fibroids are discovered but are not causing symptoms? Because some women never actually experience the symptoms that we've just mentioned.
So for fibroids that are not causing symptoms, we would say just leave them alone, but keep monitoring them, maybe by doing a yearly ultrasound, just to see how they're growing. But otherwise, if they're not bothering you, then there is no need for treatment. So they have to be causing symptoms for us to treat. Yeah.
Okay. Yeah. Will they have a risk of them growing to a certain extent that might actually go out of control?
No, they grow slowly. So, and if it reaches a point where their growth is causing symptoms, for example, if it is now pressing on the bowel, on the intestines and causing constipation and bloating, or if it's pressing on the bladder and causing you to, pee all the time or wake up to pee all the time, then at that point we can say now they're becoming symptomatic. Or if they're now causing heavy bleeding, then we say that now they're becoming symptomatic and we now need to treat them.
Okay. Now, I'm just wondering, Daktari, can they be prevented, these fibroids?
Unfortunately not.
Or maybe somebody might say, if I change my lifestyle, to a certain way, they might actually be reducing the chances of having fibroids.
Yeah, the things that reduce the chances of getting fibroids are getting children at an earlier age, or and having more children. So
having more children is also all right. There is a question here from Leah. Good morning, Bramwell and Daktari. How likely or under what circumstances are fibroids likely to turn cancerous?
So that's a good question. So a very small percentage of fibroids actually do turn cancerous. It's a tiny percent, probably less than 1%. And again, one of the reasons why we like to do an MRI when patients come to us and they have symptoms of fibroids is on MRI we are able to tell if the fibroid is looking like it's becoming cancerous or not. If a fibroid is becoming cancerous, then we recommend surgery so that it's removed instead of any other treatment.
Okay. Other than MRI, Daktari, do you have other methods of diagnosing this particular condition?
So fibroids, besides the symptoms, fibroids can be seen on ultrasound. But ultrasound does not give us a very good picture in terms of mapping the locations of the fibroids, or in terms of being able to say if the fibroids are benign or malignant. So an MRI is more superior. So for all our patients, we prefer that they get an MRI before we decide on whether they are suitable candidates for the procedure or not.
Daktari, I've also seen an argument whereby there are some people who hold the view that if I have a healthy diet, I exercise and I check my weight control, I might be able to reduce the chances of having fibroid as a condition. What is your take on that?
I think you can still develop fibroids. We get a lot of women who are very health conscious, regular gym goers, and they still have fibroids.
Okay.
And we treat them and they go back to their normal, active, healthy lifestyles.
Okay. So how often should someone with fibroids have follow-up scans?
So for after the procedure, you mean, or?
Yes.
So once we do the procedure, we see the patients in clinic, and if at 6 months, if they are not happy with their symptoms still, then we can repeat a scan. But otherwise, there's really no need to repeat a scan, unless if the symptoms are persisting.
Persisting. Yeah. And how then do you make a clinical decision between this patient is suitable for this particular treatment that we're talking about here today, or this one is just to give them drugs and then go home to manage the condition? Is there a possibility, or once they just come for MRI, they go straight for, you recommend straight for the treatment, uterine fibroid embolization that we're talking about?
No, so that's a very good question. So yeah, that's why the consultation is very important, because we have to see what are the patient's expectations, and if the treatment is going to be able to help them meet their expectations.
Okay.
If uterine fibroid embolization is not going to be able to help them meet the expectations, and other modes of treatment is going to help them meet the expectations, then that's what we do. So our treatment decisions are driven by what the patient symptoms are and what the patient wants and expects.
Okay. Yeah. All right. So you don't impose.
We don't impose or force the procedure on anyone. Yeah.
All right. And talking about medication, Daktari, I've also seen other arguments whereby people are saying if I have hormonal drugs also, they can help in shrinking the fibroids or manage the symptoms. What is your take on that?
So hormonal medication also is used to control the symptoms of fibroids, but it's basically, again, treating the symptoms, not the cause. And a lot of these hormonal medications sort of induce like an artificial menopause, but there will be a point in time, maybe after like three cycles or so, where there will be breakthrough bleeding. So the symptoms do come back, and then again, hormonal medication also has side effects, including increasing the risk of forming clots. So at the end of the day, the hormonal medication is treating the symptoms, it's not treating the cause, and it has side effects, and it doesn't always work. So,
okay.
Yeah.
All right. And also, people normally ask Daktari if there are dietary or supplement recommendations for women with fibroids.
So I would say that if the fibroids are symptomatic, such as causing heavy bleeding, then you need to eat food which is rich in iron, so you are replenishing the iron that you're losing from the bleeding. And therefore you don't become anemic very fast.
Okay.
But, yeah.
Okay. And then what about those women who are already expecting, okay, who are already expecting, and maybe they might be, they have experienced heavy bleeding at some point, but now they are expecting. What should they expect at the end of the day?
So if they're pregnant already and they have fibroids, we can't, there is no treatment option until after the pregnancy is finished.
The delivery is done.
And then,
that is when they can come for the medication.
Yeah.
All right, Daktari, I want us to take a very, very short commercial break. When we come back, we're going to be looking at some of the questions that are coming from the listeners. 0712 223385 or on Facebook page, Radio Mini 88.3 FM.
The Catholic Radio for 88.3.
This is Radio Waumini 88.3 FM. This is Radio Waumini 88.3 FM. is Radio Waumini 88.3 FM. This 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 is Radio Waumini
8.3 FM, 30 minutes to 9. I'm here with Dr. Nashad Karim, consultant intervention radiologist at Aga Khan University Hospital. We are talking about uterine fibroid embolization. All right, Daktari, there is a question here. Bramwell kindly asked Daktari, can fibroids come back after the treatment that he has just described?
Yes, unfortunately, fibroids can come back after the treatment. They come back after surgery as well.
Yeah.
So basically what happens is it's not really coming back, but new fibroids growing in the uterus.
Oh, so si ati inarudi ile ya kitambo. So
Yeah.
these ones are new.
New ones, yeah.
That are
Yeah.
growing.
Yeah.
So as they come back again, you'll have to undergo.
You can undergo the treatment again. Yeah.
Okay. There is also another one here. Doctor, what are the current research statistics in Kenya with regards to the condition? What age is most affected?
So the most affected age, 30s and 40s, are the most affected. Yeah.
That is it. Why?
I think with the way our lifestyle is going, women are having children later. Yeah.
Okay.
Yeah.
What will be your recommendation then?
Get married early.
You get married early. All right, 0712 223385 or on Facebook page Radio Mini 88.3 FM. Okay, there is another one here. Huyu anauliza namna gani? Good morning, Brahma and Daktari. Kindly, can Daktari repeat how long will I take if I undergo the procedure to go back to my normal activities?
So most women are back to their normal activities within 1 to 2 weeks. So we say 2-week period to be fully recovered. Yeah.
Okay. Then how big, Daktari, can fibroids then get, and can they make a woman look pregnant for that matter?
Oh yeah. So fibroids can get very big. We've seen fibroids even bigger than 10 centimeters.
Wow.
And we've seen women who the fibroids have grown so much that they are extending all the way up past the belly button, all the way up, making women look like they're 20-30 weeks pregnant.
Look at that.
Yeah.
Wow. Bramwell, kindly ask Daktari, are there age limits for UFE? And if there are, and those women are experiencing fibroids, what is the remedy to that?
So there are no age limits to UFE. As long as you're symptomatic, we carry out the procedure. For women who are, of course, past menopause, we would not carry out the procedure because for them we would expect that now that they're in menopause, their fibroids should naturally shrink and symptoms disappear.
Actually, that is the question I was going to ask, Dr. Because you've been mentioning about menopause. I really wanted to know what is the likelihood that fibroids will shrink after menopause?
Oh, it's almost like 100% likelihood. It may take some time, but at menopause, because the hormones that are keeping the fibroids alive go, the fibroids will disappear and the symptoms will go away.
Okay. Zenyewe tu just like that. They will just, because of the change in the way the hormones are in the body. Yeah. So they will naturally disappear as the age advances.
It may take some time as the uterus shrinks, but it happens.
Okay. What are some of the misconceptions that you've come across, Dr. in regards to fibroids?
So some of the misconceptions are that surgical treatment is the only treatment. So there are other options of treating, minimally invasive techniques such as uterine fibroid embolization, which do not involve a scar or a long recovery period. Second misconception is that there are herbal treatments that work for fibroids. I've yet to encounter one.
Yes.
The third misconception is that this is particularly for uterine fibroid embolization, that it impairs fertility and you can't get children if you undergo this procedure.
Exactly. There was that question that someone has just asked here. Sema Brabwell kindly ask Daktari the effects of UFE on fertility.
So we say no. The latest research is showing that the pregnancy rates with UFE are similar to pregnancy rates for those who undergo surgery to treat fibroids. Hence, it is as good an option as surgery in terms of preserving your fertility. The only thing is we recommend not getting pregnant for 1 year after the procedure.
All right. And then, Daktari, we are in a culture of self-medication, right? Whereby if I experience the headache, I run to the counter, pharmacist next door, all right? Yes, if I experience stomach aches, the next door. And nowadays, pharmacies are just, I don't know how these people map out. Every apartment you walk across in Nairobi, there is a pharmacy next door, okay? Ni kama wanajua tu kuna wateja hapa. What will be your advice for those women who are experiencing this particular symptom that we've explained here and they are self-medicating?
So self-medication is basically you're just trying to treat the symptoms. You're not treating the cause. Self-medication, if not done properly, can be harmful as well. So it's better to seek medical advice, see a doctor, and then consider a solution that finishes the problem. So get a treatment that deals with the cause, not the symptom.
Okay. Good morning, Bram and Daktari. Kindly ask Daktari, can fibroids cause hip-bone joint pain?
They can cause backache, and maybe even they can cause some pain to the bones because of their pressure that they put. So it depends on how big they are and where they are. And
All right. So for that patient, maybe that they are already experiencing this, what will be the remedy to that?
So first thing would be to be seen, and then to get an MRI, and we map out and we see what if that is actually the cause or if there's something else going on.
All right. There is another one here. Can breasts be affected by fibroids?
No.
These are concerns. No,
there's no effect on the breasts from fibroids.
Okay, that is it. Anyangala, I believe you've gotten the answer. So, Dr. as we are winding up, all right, what would be your clarion call to women out there, especially now that this is a Cancer Awareness Month, and you've actually answered Leah, who wanted to know the relation between cancer and fibroids? What will be your clarion call?
I would say that if you have symptoms, don't ignore them. Get seen, and then look for a solution that deals with the cause of the symptoms rather than just treating the symptoms. So if you're suffering from fibroids and they're causing symptoms, consider uterine fibroid embolization as a treatment option. Unlike surgery, there are no scars. It's a minimally invasive technique, and it works as well as surgery.
Okay, as well as surgery. Dr. Karim, thank you so much for your time this morning. At least I've learned a thing or two, and I believe my listeners are now aware of this particular treatment that is being offered at the Aga Khan University Hospital. When I visit Aga Khan, I'll ask for Dr. Karim. Sindio?
Karibu sana. Thank you very much for having me.
Thank you so much, Dr. for your time. My dear listener, we are taking a very short break for news at the top of the hour, and when I come back, I'll be coming back with Wakili to talk more about labor and Sharia, okay? Laws and labor. That is going to be a conversation in our last hour. If you have a question again, feel free, 0712223385 or on Facebook page Radio Mini 88.3 FM. But don't you forget, my dear listener, as we mark Cancer Awareness Month this February, the Aga Khan University Hospital is offering discounted rates for cancer screening tests, because when cancer caught early, my dear listener, you have more treatment options and better outcomes. Take advantage of these special offers for mammograms, pap smear, PSA, breast ultrasounds, and the FIT test, my dear listener. Walk into any of the outpatient medical centers and the main hospital in Parklands today for these particular tests. And please note, my dear listener, that mammogram is only available at the main hospital in Parklands and the current specialty center. This information is coming to you courtesy the Aga Khan University Hospital. Remember, this offer runs throughout this month of February. The 28th is the last day of this particular offer, so take advantage. And for any inquiries, call 07300 11 888, 07300 11 888. Call the Aga Khan University Hospital for guidance and for all the inquiries. Thank you so much for staying tuned to Radio Mini 88.3 FM. I'll be back with Wakili Jacob Situma.
Mini 88.3 FM.